All right. Hi, we're here with Dr. Kohli from Cherry Creek Heart, accepting new patients. You might have seen her on 9 News as well. She's an expert there, but an expert on a lot of different things that we are dealing with right now. And one of the things that I think was super scary, super sad this week, and has a lot of us thinking and talking about it is the Boulder tragedy that happened and like that whole situation. So the victims are being treated for burns from a Molotov cocktail. So can you explain exactly what that is first? Because I know there's a lot of people that might not know exactly what it was.
It's pretty dangerous, Jenny. So it's essentially a glass bottle that's filled with a flammable liquid. You're thinking gasoline or alcohol or some kind of oil type of mixture. And it usually has a wick in it. And then when you throw it, it kind of ignites the wick and causes an explosion. And it's particularly dangerous for a few reasons. One, because it gets really hot when it turns into fire. Second, it actually sticks to your clothing. So it causes more of a prolonged, deeper burn because of that, sticking to the clothing. So you have obviously the thermal injury from the fire. You also have a chemical burn from the chemicals themselves that are burning that could potentially dissolve in your bloodstream as well. And then you're inhaling the burned chemicals as well. So that's even an inhalation burn inside your lungs.
So you're just all over every single aspect. Well, and you always see it in like movies. Like you see it in like action movies or whatever else. But seeing it in real life, you're like, what? And seeing these people, and a lot of them were smart enough to roll around, to take their clothes off, to get the burns off, like to get their clothes off of them so it didn't burn. But if you get a burn patient from an attack like this, what would be like the first thing that you would treat for?
Well, you really want to think about sort of characterizing the extent of the burn. So there's two ways to do that. One is how deep is it? And the second is what percentage of the body area does it cover, including some sensitive areas. So how deep is it? So you touch a hot stove, that's usually a superficial burn because your spinal reflex triggers you to pull back right away. It's usually just the top layer. That's called the epidermis. That's a first-degree burn. A second-degree burn is the epidermis and the dermis, so a little bit deeper. You can usually get a wound from that one. Now, first and second-degree burns are the ones that are painful, right? They hurt a lot because your nerves are sort of stimulated but not burned off. Third and fourth degree burns, when you're getting into deeper tissues, fourth degrees all the way down to the bone or the fat or the muscle. And again, these Molotov cocktails can set you up for that. Those don't even hurt because you've actually burned off the nerves. You've killed the nerves. And so the idea to me, it really, even as a physician who sees burned patients, it really made me worried because you're watching people writhing in pain, burning. And then again, depending on what parts of the body are involved, they said that the fire kind of came from their feet up. But if you involve sensitive areas like the genitalia, you involve joints or muscles. And again, it gets deeper. You involve the face, you involve the hands. These can leave people with long-term disability.
Well, and what type of treatments will they usually get if they go to the hospital? Because I feel like we're getting into summertime too, and talking a lot about firework danger and like all, fire pit danger and all the other things that we're doing. It's just good stuff to know for that as well.
Very much so. So, you want to think about going to the hospital if you're an older person, if you have a deep burn or you have a wide burn or it involves a sensitive area. So those are sort of the things to think about. But in this particular case, we do know that 2 people were admitted to the hospital. In fact, are still admitted in the hospital. And the first thing to do is make sure to stabilize airway, breathing, circulation. So if you have anything in your lungs, kind of make sure that you're stabilized. But one of them actually got admitted to a burn unit. And there, what usually they do is IV fluids, to help the circulation to the burn. They also give antibiotics to prevent an infection because you're basically burning off your biggest organ, which is your protective layer, so to speak. And then they do a lot of pain control because, again, those burns can be really painful. Sometimes they'll also do what's called debridement because you want to take that dead tissue and actually peel it off. Because otherwise that can get infected. And then eventually, in a few days or so, they'll actually do something called skin grafting, where they take healthy skin, almost like with a potato peeler, and use it as a bandage over the burn, really, to help it heal.
That's amazing, all the things that they can do. But what does the recovery actually look like for?
It can be years to recover from something like this. And I'm talking obviously physical recovery, but also mental recovery as well. And if you think about it, like in the first short term, you're just kind of stabilizing the person, getting them to heal. But in the long term, especially if it involves any muscle or bone, they have to do physical therapy. They may have to do reconstructive surgeries. They may get scarring that may require plastic surgery or reconstruction. They may have non-healing burns, assuming they don't have any chronic infections or anything. And then again, the mental health aspect, the PTSD, not just I feel like for the person that had the burn, but even for the person, all the people that watched it, whether it was live or on that video that we saw.
Yeah.
You know, it just kind of stays with you.
Yeah.
And it is something that I really think it's important to talk about mental health resources. Also important to be prepared to think about how to deal with someone if you see them. It's not a situation we commonly find ourselves in, another human being burning.
Yeah.
And so you don't want to throw water on it because that could actually make the situation worse. You want to try to use a flame retardant cloth, wrap them in it, take off that clothing that's burning.
Yeah.
And if you have a fire extinguisher, that's another good thing to sort of use because that helps to dampen
Maybe
the
a good
burn.
time for everyone to kind of check their homes and stuff too, now that we're getting into this season. But just my heart has been broken for Boulder, and we are strong with you. We will be here for you. Colorado is one of those communities that we stick together, and we love you very much. So you take care of yourselves, okay?
Boulder strong.
Boulder strong.